Good afternoon, everyone, and welcome to the March installment of our Alumni Lunch and Learn series at the L. Douglas Wilder School of Government and Public Affairs at VCU. My name is Stephen. I'm the Director of Development and Alumni Engagement here at the Wilder School. For those of you who are joining us for the first time, the Wilder School hosts free virtual events monthly like this one. Each session features change agents, thought leaders, and policymakers who provide insights and commentary on the relevant topics of the day. Today's topic is titled Marijuana, Cannabis, Weed. Is Virginia Ready for Regulation? With our speakers, TJ Gordon and Greg Felix. Before we get started, we are excited to announce our new online MPA program, which is accepting applications. You can find more information on this slide that features the deadlines and also promotes our new MPA program online. Again, you can find those deadlines here. Now, a word from Dr. Susan Gooden, Dean and Professor at the Wilder School of Government and Public Affairs, who will introduce our moderator. Dean Gooden.
Thank you so much, Stephen, and welcome everyone. We're delighted that you're joining us this month for our Lunch and Learn series. This has been a great series for the Wilder School, and we really appreciate your engagement as we try to explore timely topics, policy topics that might be on our minds that we're interested in learning more about. And we will certainly do this in today's session, which will be excellent. I would be remiss in my role as dean if I didn't share good news about the Wilder School. We're certainly really pleased with one of our distinguished faculty members, Jay Albanese, who recently received the Outstanding Faculty Award from SHEV, the State Council of Higher Education in Virginia. And so we're delighted to be celebrating that, along with our new MPA program that Stephen referenced. Application deadlines are May 1st. We still have the traditional version for those who will continue to like to pursue our graduate degrees on in person. But you can do your online degrees in public administration and homeland security and emergency preparedness. So just wanted to emphasize that. But for today's session, we are really delighted to have two extraordinary individuals with us, one serving as moderator and the other as our keynote speaker from KPMG. As you may be aware, KPMG is one of the Big Four accounting firms in the world, with headquarters located in the Netherlands, in Amsterdam. And they provide services in more than 140 countries across the world in terms of audit, tax, and regulatory services, as well as advisory services. So it's a great organization, a big organization, and they also do work in Virginia. And so that's what we're focusing on relative to the work here today. So they have a broad view as well as a local view. I'm pleased to introduce the moderator today, who is TJ Gordon. He is an account relationship manager in KPMG, and he works very closely with state and local governments across the United States. And in particular, he is the lead for the relationship here in the Commonwealth of Virginia. And so in all of the work that he does, he is approaching it through a Virginia-specific lens. And he is actively involved in the Richmond community. He has served on and connected with various groups, including RVA Tech, the Richmond Chamber of Commerce, the Northern Virginia Technology Council, and the Virginia Chamber of Commerce. So I'm delighted to welcome TJ Gordon with us today.
Thank you, Dean Gooden, for that wonderful introduction. And I'm glad you brought it back all local, because KPMG is global, but my sole focus is waking up every day and thinking about how we can leverage those, national and international insights to help make Virginia government more efficient. But enough of that. I'd like to introduce you to our expert on cannabis legalization today, Greg Felix. Greg brings nearly 30 years of experience to his role as Vice President of Strategic Solutions at Accela. And in this position, he is responsible for providing the Accela cannabis civic applications to state and local governments, agencies across the U.S., regulating the emerging, legal, and often complicated cannabis industry, as we've seen with the back and forth on the legislative side in Virginia. Previous to Accela, Greg has held a variety of IT and leadership positions. Most recently, he served as the Area Vice President for Airstrip Technologies, promoting emerging technologies such as enterprise-wide clinical mobile health solutions to national healthcare organizations. And then prior to that, he was the Senior Enterprise Vice President at Allscripts, Regional Vice President at Complexities, and has held strategic roles at McKesson. So really a career that has spanned multiple leadership positions. And without further ado, Greg, I'll pass it to you. And I stole a little clip from you from our prep session earlier, but I think it's something to really keep in mind. But a successful cannabis legalization really takes into account not only the politics, but also the policy and technology as well. And so in order to get to, a successful commercial legalization, one must take into account all three of those things. And that's a little bit of what Greg will be going over today.
Thank you, TJ, for that introduction. I appreciate it. I'm going to take ownership of the screen for a moment here. Let's see if you guys can see this. Okay, just a quick check. Everyone seeing the screen? TJ,
yes, I can see it.
Yeah, perfect. Okay. Well, first of all, thank you for inviting me. Dean Gooden, I've had my coffee, so I'm going to be going through this material very quickly, but I'm hoping it's going to be useful for your attendees. So what I want to focus on here is where politics, policy, and IT, automation, and software solutions really kind of intersect in the area of cannabis regulation. A lot of this material I'm going to present to you could be viewed later on, but what I want to do is provide you with just a little bit of context that's driving this market. We don't need to spend a lot of time just reviewing what the public perception is with respect to legalization of cannabis. We all know that it's high and it's increasing, no pun intended, but that voter demand is driving the market. But I think more importantly, what's driving the market is this notion of there's sales for cannabis that is increasing. It's generating jobs, it's creating businesses, and it's quite impressive. If you look in 2022, roughly about $18 billion in sales, retail sales of cannabis has occurred, and that's generated just about 321,000 cumulative jobs in this market. That's a big incentive and driver for legalization. But probably even a bigger driver is this idea of tax revenue that comes to state and local governments. And you can see the numbers here continually increasing in 2020. Across the US, we saw approximately $3 billion in net new tax revenue. And based on what we saw in the pandemic, a lot of state and local governments really do need to look for other areas of tax revenue. And this is one area. It's not the only reason anybody should legalize, but it certainly is a side benefit. But there's also elements to it that we have to be careful of. Too much taxation actually elicits, or I should say, makes more robust the illegal market. We can talk about that at some other time. What you see in that smaller chart in the middle portion of the screen are those states that are contributing so far to that $3 billion, but there's many more states that are potentially going to be legalizing that could drive another $4 billion in net new tax revenue to state and local governments. So that's a pretty big attractant. What has occurred across the country when we look at legalization, this is what the map looks like today. The legend is obviously self-evident, but I'll just real quickly unpack this for you. There are currently 21 states that have a medical-only program. What a medical cannabis program entails is usually a set of diagnoses that qualifies a patient to be a medical cannabis patient. With that comes the responsibility of vetting those care providers that would be recommending cannabis and vetting those patients against those diagnoses, and then setting up a legal framework for which medical cannabis can be provided to these patients. This typically involves the Department of Health. In fact, almost always involves the Department of Health. It can also include the Department of Taxation and Revenue, sometimes the Department of Agriculture, sometimes it's the Department of Consumer Affairs, just depends on the state, but it always includes the Department of Health. Then what happens is generally the trend has been that these programs then expand. They add more diagnoses, more patients come into it. And certainly Virginia is following along in this same pattern. At some point, either through ballot measure or direct legislative efforts, the states will then add to the medical program something called recreational, or you may hear it called adult use, where you don't need a medical ID card in order to purchase and use cannabis. In states that have followed that, you'll see in green, where they were first medical, then they moved into adult use and so forth. So those green states have a full, complete medical and adult use program. And then there are states that are looking to either stand up new medical programs, expand their existing medical program, or take their medical program from just medical only to medical and adult use. And these are happening either by ballot measures or legislative efforts. Not all of these will make it through. What I'm tracking is probably about 6 of the states that you see here with these stars will likely make it through in the November ballot measure. Most of them are on the ballot measure. Will make it through for legalization. So the way it normally works is once legalized, then it gets tossed over to the agencies that are going to be responsible for promulgating the rules and regulations. And as I mentioned, it could be the Department of Taxation, it could be Agriculture, Department of Revenue, and so forth. And they are responsible for standing up the rules and regulations. Generally, there's a commission that's established. I believe Virginia has established a commission. It's already got 2 people staffed in it. And this is where policy intersects with technology. And of course, this always involves politics, but it's a very complex set of issues and concerns. I'm not going to read through all of these for you. You can read the slide. In each one of these, we could spend 15 minutes unpacking the realities around these. It's one thing to recognize they need to be addressed. It's quite another to understand the nuances. So if we take, for example, social equity, simply by standing up the rules and regulations of social equity really isn't sufficient. There's a whole world of experience, nuance, and considerations around social equity when we look at it from the social equity applicant's perspective, and also those who are regulating the cannabis market and who are supporting social equity programs. It's a very complex matter. Cannabis regulation is like no other regulation. It's not like alcohol. You can't equate it to, say, tobacco or any of those others, primarily because there's always this illegal market sitting in the background, pressing against all of these complexities and goals of the agency. So what really needs to happen is the legislative and the regulatory framework needs to be operationalized. It's one thing to stand it up, but it's quite another to operationalize and sustain that which is set by those regulations and the goals that are associated with it. But what we see very often is a major disconnect between technology and policy. And so very quickly, I want to give you a sense of what that might look like when it isn't indeed an ideal intersection between those items. This is what a typical state or local government would need to ensure that the cannabis businesses, whether they're cultivators or licensed or retail shops or delivery services and manufacturers, they all need to be vetted. And those businesses need to be vetted by the agency staff and the departments in that agency for appropriateness of that business and all the things that need to be done to ensure that these are, good actors being moved into this market. Once they do that, there's all of the requirements associated with things like inspecting those businesses, ensuring that they're complying with all of the appropriate rules and regulations, and that compliance is sustained as well. And then there's, of course, the need to look at the data that's built up in a digital format and to get analytics to further inform decisions that would be made and could even impact ongoing changes to rules and regulations. But it doesn't stop there. Those businesses are providing product, and that product is the supply chain that needs to be tracked and traced. So it's tracked, that is from the manufacturer to the retail store, and traced. Should there something go wrong with that product, you need to trace it back to its origin. And so you'll hear talk of a track and trace solution. Virginia has one, and that's a necessary portion of this. What makes us a little bit different and what we are advocating is an integrated solution where these are not patch quilt solutions, kind of Frankenstein put together siloed solutions, but rather one solution integrated and on a common platform delivered in cloud technology, and then also leverages some of the newest technologies out there, and I'll tell you a little bit about that, to ensure that this is a reflection. What we are really employing here is a reflection and expression of the rules and regulations for cannabis regulation in the state, in the local government. The other portion that's needed is a patient registry. Think of this as having the same HIPAA compliance standards as a medical record system in a hospital. It needs that level of HIPAA compliance and all of the tools necessary to ensure that a medical patient is indeed, protected with respect to that information, but also is able to gain access to the medication, in this case, cannabis, as they would need. So what we bring to the table is what we think is the ideal approach, and that is a prescriptive, integrated, unified a solution that looks from end to end the entire spectrum of what's required in cannabis regulation. And then finally, there's something else we can add to that, and it's analytics. I'll give you one workflow or one work case example of how analytics can provide some insights. If I'm a cultivator and I've reported to the state of Virginia that I've just produced 1,000 pounds of cannabis, the state of Virginia is going to say, okay, I'm going to have to trust you on that. Here's your tax bill. But what our analytics can do, since it has awareness of that business, and it has awareness of the amount of cannabis cultivation product for that particular business, but it also has awareness through algorithms how much water and electricity would be required to produce 1,000 pounds of cannabis flower. It can go out and it can look at the utilities that are associated with that business, and it's going to detect anomalies. Why is this business consuming 5 times the amount of water and electricity than would be expected to produce 1,000 pounds of cannabis? It could very well be that that cultivator is shunting what should be product into the legal market, into the illegal market for the purposes of generating more margin. So this whole notion of proactive, predictive analytics ensures that the entire framework is working towards the goal of things like driving out the illicit market and ensuring that product integrity is established. So when we look at this from I'm going to drop down just one level deeper. When we look at things like track and trace, the market has changed considerably. What was applicable and useful 8 years ago that was designed in some of the early adopters no longer applies. So now in track and trace, the idea of an RFID tag has really become fallen out of favor. What really is needed is something like this, a serialization granular down to the retail unit, whereby it is submitted to blockchain, it's granular, there's no costly RFID tags that are required, and all of this is highly secure, so down to the product. Now, we can trace it back up. Should there be a problem, say with mold or a pesticide that shouldn't have made it into that product, we can see things now in a much granular fashion, and it's all secure. Another area of advancement for a next generation solution is, we can produce medical ID cards, and that's fine, and they can't be tampered with, and there's all kinds of things that we do so that they can't be counterfeited. But more importantly, we can do things like provide a digital medical patient ID identification. So think about this from the perspective of a patient who might be traveling down the street and they've just purchased their cannabis, but they happen to get pulled over. They can show this to a law enforcement officer. They scan that, and it brings up the fact that this is, yes, indeed, a legal medical cannabis patient who is, authorized to be carrying or has some certain amount of cannabis on them, and it's legal for them to do so. So all of these kinds of technologies and many, many more that I can't cover here really define what we're calling the next generation solution. And the point here is that we need to leverage technology to ensure that policy is expressed in the regulatory framework, and that's exactly what we do. Some of the other things that we can do now that we have digital data is provide dashboards to those agencies, and I mentioned them. It could be Department of Taxation. It could be, the enforcement agencies associated with it. It could be the licensing agencies, and they all need the ability to have dashboards that bring to their attention, even geographically, where things such as, licenses that are about to expire, and let the system automatically communicate with those businesses that says, hey, your license is about to expire. You got 60 days to renew. And oh, by the way, there is a new rule that you need to comply with, and we need some additional documentation as you submit your renewal. All of that being automated ensures that you can do more with less from the state's staffing perspective. Looking at things like, violations, where are they happening most? When are they happening most? What is the reason that they're happening most? So perhaps there's some problem with delivery services. And very often what this will do is will inform the rules and regulations that very often these jurisdictions, whether it's state or local, have to go back and revise their rules and regulations to ensure that they're hitting the goals of that framework. And I think the rest of it's pretty self-explanatory. We can drill into this information. We can slice and dice it. You can only do this when you have a fully integrated end-to-end digital solution that's supporting and expressing those rules and regulations in cannabis legalization and the regulation of cannabis. So I want to make a couple of other points. In the state of Virginia, very much like some other states, when it goes recreational or adult use as it's sometimes called, more often than not, the states will set up what's called a dual licensing framework. The state can issue a license, but the local, that is the county or the city, may also issue a license. Maybe it's just a permit, maybe it's a full license, but each has its own responsibilities in cannabis regulation. That requires communication, information exchange between the state and the local governments for the healthiest form of cannabis regulation. So what that might look like at the state, I've just taken you through what's needed at the state. The state's always responsible for things like the track and trace, the patient registry, and of course, licensing those businesses at the state level. But the state needs to also interact with the local to know things about the local, that business that's parked in that local jurisdiction. And the things that you're seeing in that blue box are just an example of some of the types of information that state and local governments need to share between one another. The problem, though, is that very often the local may not be automated. They may have just spreadsheets or nothing at all. They're doing it all on paper. And that becomes a huge impediment between state and local governments to ensure that they have the healthiest form of a regulatory framework. What we recommend and can do is actually, for the local, provide a similar solution, all of those same capabilities to license and vet those businesses, but we can now have near real-time data exchange between state and local. So no more mutual mystification as to what one business is doing at the state level and how the locals are also communicating that information. So that's an important element that really ensures that the regulatory framework is operating at its healthiest possible level. And then we need to think about what happens when at some point in the future, a federal prohibition is removed. We're going to start seeing interstate commerce for cannabis, kind of like what you would see in alcohol. And so what we need to do is start planning for it. I call it, you've heard the phrase skating to where the puck is going to be. And imagine a pod of networked solutions communicating with one another with respect to cannabis products moving across the country. So for example, Humboldt has set itself up as being a specific appellation, kind of like wines, where you want to buy a wine from a particular geographic area because of its excellent flavors and so forth. Humboldt's doing the same thing, setting its branding, and is getting ready for that day when, in fact, someone, say in South Dakota, wants to buy Humboldt-grown cannabis. And that will be available when, in fact, there is the removal of prohibition at the federal level. And then we can also think about things related to banking as well, once that prohibition is removed. So I wanted to just very quickly show you that I mentioned we're skating to where the puck is going to be. That's exactly what we're doing. These are just an example of some of the areas, some of the jurisdictions for which we are installed following this pattern, what I've just described to you. It's at the state level, but it's also at the local level, counties, some of the largest growing regions in the country, Santa Barbara, Humboldt, and so forth, are using our system. Some of the largest local jurisdictions, City of Los Angeles is bigger than many states with respect to the number of cannabis businesses. And really the complexity around things such as social equity, state of California is using it, but it also smaller jurisdictions such as state of South Dakota for their newly established medical program. And so we're already starting this process of looking towards what happens when, in fact, federal prohibition is removed. We think that there's going to be a seismic shift. And what we don't want to do is, be dealing with this situation where a jurisdiction is kind of like created a silo into themselves. And now the whole market has shifted and they're not prepared and not able to take advantage of that. So I'm going to end off here by saying this. Experience is critical. KPMG and Excella have been at this I've been doing this for almost 6 years now. We've got the lumps, bumps, and scars to prove that we have the expertise. It's not enough to simply recognize the category of what needs to be established for the rules and regulations and the legislation. It's the nuance that's associated with it that makes the difference between success or difficulty in a cannabis regulatory framework. Experience is really important. Experience in advisory services and the implementation, but also experience in a solution that's agile enough, that's configurable, that will allow the jurisdiction to essentially build the regulatory framework and express it in the software, and then on a dime, be able to modify that because things have changed. So experience matters. Having the right automation. When I use the word automation, I'm talking about software, I'm talking about the approach in software, but also the implementation that's associated with it. Having the right solution in place is critical. Now, what happens when in states that have a medical program and then suddenly, say by a ballot measure or legislative, they go to adult use, oftentimes what they'll say is, well, we'll just simply use what we currently have for the medical program. They're entirely different worlds. And what they're finding is that was a mistake. Simply using what you might have thought was adequate is really not a wise choice because it's an entirely different world when we get into adult use. The market's different, the players are different, and the requirement for automation is very different. And we've seen examples where states have really stumbled because they've made that assumption. How hard could this be? It's just like any other licensing. Those are the kiss of death, famous last words. And so having the right automation is imperative. And then lastly, this is really important. Proactive approach to this is far better than reactive. What reactive looks like in terms of bringing together policy and information systems is waiting until the last minute to determine how are you going to operationalize this and sustain this. When you wait till the last minute, then you've got maybe a statutory deadline breathing down your neck. And what you have to do is say, we'll just make do with what we currently have. And that turns out in many cases to have been a massive mistake. So they're in reactive mode. Proactive says, we're going to bake in the full spectrum, the holistic approach, not just the legislation, not just the rules and regulations, but all of the nuances that need to be taken into account and the advisory that goes along with that, and the technology to operationalize and sustain that which is our original goals. And the good news is that Virginia has time to be proactive. I believe the adult use program won't likely go forward in earnest for at least another year, year and a half. And that gives the state time to be proactive, to think through this and to look at it from a holistic perspective, everything that I just mentioned, to ensure that success is really, is something that you bake right into the regulatory framework. So TJ, I'm going to stop there. I tried to stay on time. I went very quickly through this material. There's much more we can cover, but with that, I'm going to turn it back over to you. And then I think we may have some questions as well.
Yeah, thank you, Greg. That was very insightful. And so we did get some questions in the chat. But before getting into those, I have a few questions on the slides that I'd like to go over first. And one is about that matrix of complexities, right? Because I'm sure you just boil them down to larger concepts, but if you were to, put them under a microscope, the complexities probably, near infinity. So with those larger ones, is there any order of precedent or any of those bullet points where you see states have major hiccups by not addressing it earlier on in the process, or does there have to be a way to address those all those equally, from day one?
Good question, TJ. So the number one, it's on everyone's number one list, public safety. Anytime you have a product, THC, that impacts motor skills or cognitive skills, that could represent risk to the public. So public safety is number one. But it's also public safety with respect to the veracity of the product, or the integrity of the product and so forth. So that's number one. Right on the heels of that, right now in present, contemporary context, social equity and tax revenue are two very high priorities. Social equity, we could spend hours talking about the reasons why and the nuances around social equity, but done improperly, you actually could hurt the goals of what's being sought for in social equity. And those nuances need to be known. It's not just a matter of we intend to make an equitable program. It's many, many nuances. I'll give you one example. Think about real estate and the predatory practices that's occurring against those equity applicants that we're starting to see in the market right now. And those predatory contracts it's really another way to victimize folks who have already been hurt by the war on drugs. So it's those kinds of things that we can help with. The other one is tax revenue. Tax revenue is a good thing and a bad thing. It's a good thing for all the obvious reasons, but if it's dialed up way too high, what you end up with, and the state of California is struggling with this right now, is the tax revenue or the taxation is so high that it forces the consumer into a choice. Do I spend 2.5 times more for my cannabis just because it's legal? Do I go to a guy that knows a guy who can get it to me, and it may be illegal, but it's quite a bit less expensive? So what's happened when tax revenue is dialed way too high, you actually accomplish what you're trying to avoid, and that is making the illegal market more robust. Those two are the top two, right below safety. The others can be discussed in varying degrees of what their priorities are, but those three. So it's public safety number one, social equity number two, tax revenue number three.
Gotcha. Thank you for that. And I know Virginia, at least from looking at this latest budget, has done some, or is appropriated some investment in public safety. I've seen some budgetary items as it relates to Virginia State Police, as well as I believe Department of Health, in the sense of investing in education for school children or teenagers around the risk of early use of cannabis. On that, I also wanted to pivot to, you mentioned the federal impact and the possible seismic shift. I feel now, just in the general news, that whenever states are looking at whether it be a medical or a commercial legalization, there's always the federal government, right? That it's still a scheduled substance in the back of the mind. Can you talk about, any impacts that may have, whether from an operation standpoint, a policy standpoint, that you think would happen if the federal government were to legalize cannabis nationwide or on a federal level?
Yeah, it would be seismic. I would say the first thing that was in this world, follow the money is where I usually kind of look at it. Once federal legalization occurs, suddenly the banking for cannabis, it all shifts. Today, mostly it's being run in cash, and that's dangerous. Having a delivery truck from a cultivator carrying a bunch of cannabis to deliveries to retail shops is dangerous enough. Having them carry $300,000 of cash back is even more dangerous, and it's just a dangerous thing to do. When federal legalization occurs, because banks under FDIC today, they can bank cannabis money. The problem is it's very onerous on the bank to be able to identify that which could potentially be laundered money, which is what the federal government would see cannabis today, and parse that away from legal transactions. So most banks just simply say we aren't going to do it. You can find some banks that will do it, and they've applied all kinds of human resources to be able to do that work, but not every bank, most don't want to do that. So once federal legalization occurs, now the banking industry blows wide open. That's going to bring more investors into the market. That's going to increase states, I should say, reduce their reticence to be involved, and it's going to reduce it's going to impact local jurisdictions. Many county and cities across the country that have legal cannabis right now, those counties that have opted out have banned it, and primarily they're saying until it's federally legal, we don't want to tangle with this. So it's going to change everything.
Yeah, I've got you. Thank you for that. That all makes sense. And now I'm going to pull a few questions we've had from the chat. And the first one from Michelle P. She asks, have you found that Virginia is ready to have this conversation about implementing these tools to manage the program, since we are currently struggling to legalize adult use retail? Or are they in the space of, will we have this conversation when we legalize adult use? She's saying it feels like Virginia has been reactive thus far.
In Virginia's defense, this is not easy stuff to do. And to be honest with you, the way it's been working for states that have gone before Virginia, there is no book they can go to that says this is how you do cannabis regulation in today's world. They're all learning from one another. And what happened is they started pulling from those early states, such as Washington, that 8 years ago stood up their rules and regulations in that context, in the context of that time. And so what they're doing is they're replicating that which occurred 8 years ago. In Virginia's defense, I think that taking a slower approach is a good thing. What I would recommend, and the answer to directly answer that question, no, I don't believe that they are considering this integration of automation technology and so forth to operationalize and sustain the rules and regulations and the legislation. But that doesn't mean that's not an opportunity, and that's something that we should be talking to them about. It is Virginia's opportunity to be the thought leader in the South. To say what went before 8 years ago was fine then, but we're Virginia and we do things in a different way. And the way we're doing it is to be able to focus on this more prescriptive, integrated approach, holistic end to end. So I hope that gave you the answer. I don't want to come out and say no. I'm going to come out and say, there's an opportunity that we could talk about this.
Yeah, I would say, just to comment on that a little bit more, just my experience and my own observation, right? We're talking about these tools to implement, and I don't know necessarily if we're there yet, since the policy is still, in question. So I feel like it's important to have, right? It's important to have the instructions on how to build before you start building, right? Build as you go along.
Yeah.
And so with that, Michelle, I'd encourage you to look at the Virginia Cannabis site. as well as do some research. There's two great guys working on the Cannabis Control Authority. I believe it's Matthew Prentice and Jeremy Price, both with policy backgrounds. And so if you had any questions specifically as it relates to that, I would turn you to those two resources. And then we have another question from Michelle. She asked, do you see a future in which a state says we only need to manufacture X amount of plant to produce Y amount of product so that the market doesn't see a glut like we have seen with the glut of CPD that has driven down costs and led to the production and market of material like Delta-8 THC?
Wow, Michelle, that's a great question. The answer is absolutely. This is what analytics can do. Again, when you have an integrated solution, that is a solution where the track and trace, all of the supply that's being produced and demand can now be seen through analytics to go to this issue. It's my third bullet point on the list here, access and then supply and demand. I think, Michelle, that's ultimately what you're talking about, supply and demand balance. When that gets, either supply or demand gets out of balance, you see some really crazy things. Oregon had a problem where there was an oversupply and the surrounding states were really complaining that all of this Oregon grown cannabis was making it over into Idaho, which ought not to be. Oklahoma is another example. I don't know if you knew this, but the supply and demand equation is so out of balance there. There are more retail dispensaries in Oklahoma than there are combined Starbucks and McDonald's retail shops. In fact, in some parts of Oklahoma, on every corner, you'll see a cannabis retail shop. That's another example of supply and demand being completely out of whack. This is where analytics can help, and this is where analytics can help ensure that the supply and demand is in balance, and that's a great question.
Thank you, Greg. And just pivoting here a little bit, I just wanted to go back into the licensing framework. I guess in your experience across the nation, right, there's various ways in which different states address the licensing or the equity component, right? It could be through tax dollars reinvested back into traditionally disadvantaged communities, or it could be in the way that they process licenses. Have you or Excella had any experience in working with policymakers as they figure out this equity component? And can you discuss a little bit on into how that's implemented into the system at large or across the various licenses that are awarded?
Sure. So TJ, what typically occurred, well, what has occurred is, as I mentioned, states have kind of followed what was really originally designed 8 years ago. And 8 years ago, no one was really thinking about social equity. That doesn't mean that it wasn't there and that the effects of it wasn't there. They just hadn't thought about it. So for example, the early regulatory frameworks, and they still do, have certain requirements for you to, in your application, submit and be approved. One of those requirements is that you not have any kind of drug conviction. Well, when we look at social equity and we look at the disproportionate application of the war on drugs in various communities of color, immediately they were excluded from this market. So they get, the social equity applicants, the folks from those disproportionately impacted areas get a double whammy. They got arrested more than most, and now they're precluded from being part of this market. Many of these folks become quite wealthy by virtue of this market. So what social equity does at the application level, it gives the state and the locals the ability to say, okay, yeah, our rule is typically you cannot have a drug conviction, you can't have a weapons conviction, you do not get a license if that occurs. However, if you are applying as a social equity applicant, that rule is, if you will, relaxed. It's taken in, but it's not going to be the thing that immediately precludes you from getting a license. And in fact, it may very well be something that says, if you've been injured because of the war on drugs, that is reason for you to have, be part of this pool of applicants that are considered social equity applicants. So it's very important that the solution that is being utilized is flexible and agile enough to make those distinctions to reflect the rules and regulations to address that. How they are selected, there's really three basic ways. Once they have been, pre-vetted, you have these pool of, qualified cannabis applicants for social equity. They either get selected for the licenses, since there's usually a limited number of these licenses available, either by, it's called merit-based. Some have done it by first in, first out, or I should say first in gets the license, or a lottery, a complete random drawing. It's turning out that most are now directing their attention or focus around the lottery. First in doesn't work very well. There's technology considerations that could be a problem. Merit-based, there's some element of that always in it, but the random selection takes away any of the problems that would be lodged by someone who said, I was treated unfairly in this application process. And so that's what we're seeing right now, is a real focus on this notion of a random selection from this pool of applicants that qualify for social equity.
Gotcha. Thank you, Greg. I'm just monitoring the chat right now, and it seems like we have a follow-up question to that, which may be more opinion-based. But Michelle Holder also asked, do you believe that the application fee excludes most of the social equity applicants?
The application fee?
Yes.
Yeah. So what a lot of state and local governments are doing is providing a relaxed, in some cases, a completely removed application fee, as opposed to non-applicants who do have some pretty heavy fees that are associated with the application. There are some local jurisdictions and now states. So for example, the state of California just released another $100 million in grant funds to local jurisdictions to help them help social equity applicants stand up their businesses. And this includes everything from hiring lawyers to help them through the application process, to advisement on how to run a business, to really a lot of different services for these applicants. So it's more than just the application fee that needs to be accounted for and really reduced, and most are doing that. There are some whose taxation rates are being lowered as a result of being a social equity applicant. But it goes beyond that. There's other helps that need to go to the social equity applicants, and state and local governments are putting their money where their mouth is, and that is they're actually providing a significant amount of money for social equity applicants.
Gotcha. Thank you, Greg. I think that addressed it thoroughly. So I just have two more questions. One as it relates to cannabis, and then one there was an inquiry into any data science internship opportunities, which I know we have at KPMG, and I imagine at SEL as well. But before we do that commercial, I just have one more question specifically as it relates to Virginia, just because we are a one-term governor commonwealth state, what have you. Do you think there's any risk, in the sense that whoever comes into the governor's mansion, whether they be Republican or Democrat, only has 4 years to really implement their policy? So this could flip, this has the potential to flip-flop every 4 years and the policy with it. And then, that eventually waterfalls down to any of the operations, that the Cannabis Control Authority, Department of Health, state police, corrections ultimately have to enforce. Do you see any risk in that one governor term from a policy standpoint?
Yeah, so I can only look at the data, what the trends have been. The inflection point is when, in fact, the program is established. Mm-hmm. So the politics that play out there, it's binary. It's will the program be enacted or not? So if it is a governor or a legislature or a administration that is favorable to it, it gets enacted and then it stays in place. Even if an opposing administration comes in, the program, so far I've not seen any of them removed because of a flip in the political structure. The inflection point is at the point that the program is stood up. Now, it's possible that things were streaming well into the, gee, this is going to be an adult use program in November, we're going to stand it up, and then there's a change in administration and everything slows down. I think that's probably what's been experienced in Virginia a little bit. There was some initial thought that it was going to be accelerated after legalization, and then that changed. But the inflection point is when, in fact, that program is more fully deployed. The medical program's in place. The new administration has come in. The medical program has not gone away in Virginia, and it won't go away in Virginia. So I don't see it as a change in administration means the program goes away after it's been established. Once the cat's out of the bag, it's out of the bag. But does it get out of the bag is the question.
Awesome. Thank you, Greg. And I think that just about wraps up from the questions from a cannabis standpoint. Now I'm just going to move on to address Christine George. She asked about the analytics you talked about earlier. She asked if we have any data science internship opportunities, to which on behalf of KPMG, I would respond yes. I would even go as far as to say, it's one of our most in-demand areas, just because data science, really anything to do with technology, is just so high in demand these days. We literally cannot get enough people. So I don't know the best way to go about connecting you with Christine. I'd love to pass you on to the correct recruiter. I don't know if working through Dean Gooden, and I can pass on my email that way, or putting it in the chat. But I'll defer to Stephen or Dean Gooden on which is the best way to connect you with some of the data and analytics internships at KPMG.
Yeah, and TJ, I would just simply remark on that. The importance of having digital data can't be overstated. I don't know if you realize it, but a lot of states and locals are still operating off of PDFs. So when you do an application, you're filling out a PDF form, but it's essentially paper. That data is then either somebody has to hand key that in, nobody's got the resources to do that, or it's lost. We completely reject that notion. So by having digital data, then the data scientists can mine it, and there's just incredible opportunities for new discoveries. For example, what is the relationship between the utilization of cannabis on a medical perspective and, say, the opioid crisis in a state? Does the increase of cannabis use, does it impact what's showing up in the emergency rooms for overdoses in opioids? Maybe, maybe not. But unless you have digital data, we can't answer that question. We can't even ask the question. So that's just one example. There's so many opportunities in analytics in this world.
Thank you. And
Awesome.
from the school's perspective, I just wanted to add that Shawana Isom-Payne is our Assistant Dean of Student Services. She works and coordinates our internship program. And I believe she's attending this session now. So Shawana, I'll ask you to follow up with TJ.
Awesome, thank you. I think that just about wraps it up for questions and the presentation. Thank you, Greg. Thank you, Dean Gooden, for having us on today. I think the main takeaway here is that cannabis legalization, at least as it relates to commercial legalization, is a complex topic, right? And any legal, right, any policy implication, any policy that is enacted will have implications no matter which side of the aisle that they fall to. And so with that being said, I think Virginia is in a unique position to leverage what is currently happening across the United States from a legalization standpoint. And as I'm sure some of you are following, right, we have about 3 years to do so. I think the most recent bill in the General Assembly was shot down, and so the October timeframe of this year is now being pushed back to the original timeframe of 2024. So as Greg was alluding to earlier, it buys us some time to get the policy right the first time, to get best practices from other states, and ultimately implement a regulatory framework that is beneficial to all. And with that, Stephen, I'll pass it back to you.
Thanks, TJ, and thank you, Greg, for such a in-depth discussion here. And I'm glad we were able to answer the questions of our audience and really get a good grasp on everything you had to offer. And thank you, Dean Gooden, for setting off this event. I'll just have a few announcements and then we'll be done here. First, our Policy Bites newsletter is available to everyone for free. You can subscribe at Wilder School at vcu.edu. Next slide. Now is the time to register for the 2022 Excellence in Virginia Government Awards ceremony, which will be hosted on Tuesday, April 26th at noon at the Richmond Marriott. Please contact Paula Otto if you have any questions. I've also included in the chat a link to the event page where you can also register, or you could use the link that you see here on this slide. For our awardees, please see the next slide. And as we close here, I want to thank the special thanks to our communications team in the background who is making all of this kind of come together. I also want to say that our next Lunch and Learn will be May 18th. So please save that date. We will not have a session in April as we are focusing on the Excellence in Virginia Government Awards, which you can register for now. Thank you again and have a great rest of your day.